Dr. Miller with a video on this concept of recomposition. Is it possible to gain fat-free mass, muscle mass, and lose fat mass at the same time? What kind of brought this to my attention is I've been diet coaching for years now, and I see this. I've heard this idea over time that you cannot do it in trained individuals. When untrained people, sure, they could see significant losses of body fat and increases in fat-free mass at the same time without with a no caloric deficit, no hypercaloric condition. So recomposition, roughly your body weight stays the same by change. So this recent article at the time I made this video, this was in Strength Conditioning Journal. I believe it's open access. You can see the title there. Some of the research on this that wrote this review paper are people that have been involved with the field for a long time, and I would consider as close to an expert as you can be in something as possible, or at least in that upper tier of people who are involved in research and are disseminating research. So, and both understanding the practical, it's not just laboratory stuff as well. So this article does a good job of outlining some of the challenges that are associated with trying to figure out body composition, recompositioning, if it's a supported idea in trained individuals in particular. By the way, if you like this video after watching it, leave a comment or a like, and of course subscribe to my channel for more videos. I've released, I think, up to 45 videos now at the time of making this video, covering a variety of topics in the field of exercise, sports science, nutrition science. I have a book club going. I have all these different variety of things that I'm going to start putting up some journal articles as well. So if you're interested in more information from me and the topics you find are all over the place, be sure to subscribe to this channel, hit that notification bell as well. Okay, back to this idea of recomposition. So a couple important points. So number one, in these research studies, what type of body composition methods are they using to assess? And it's just something to be aware of. So every body composition assessment has a range of error associated with. Even the DEXA has well over 1% error. And I say well over, I'm talking about moving towards 2%, not like 25%. Okay. Some of these other BIA devices like handheld or stepping on the scale, it could be as high as 4%. So that's a big error, big margin of error, especially even just looking at reliability, which would be nice even if you could have something that's reliable. So retest reliability, we're getting the same result every time. We know that although not valid, at least it's showing us change, or not. The validity is a little weaker, but at least the reliability is high. So, like BOD-POD studies seem to be pretty good. Again, SEAM. So we kind of take that into account when we look at the research literature. And the authors of this particular article do a great job of pointing that out. So in trained individuals, is it possible to gain fat mass and lose body fat without seeing significant changes on the scale? The traditional approach is no. You have to either go one or the other. You have to either go all out and do a massing phase, which could be a time when you see some significant bloat, right? You lose all your lose the contours of your body, right? You see a lot of gain in body fat, but at the same time you gain muscle mass at a significant rate if the volume is volume of training is going along with that. And then conversely, if you lose body fat, you're just going to hold on to your fat-free mass as much as possible as you are going to a hypocaloric diet. Can you stay somewhere in between and either what I call a slow mass or maintenance mass, and see this, or just go into a straight maintenance and just hold the body weight somewhat stable and see change in recomposition? And the authors of this very importantly point out some of the limitations in the research that we have, and don't jump to a conclusion. But it seems to be that in the research literature, and from my own experience in the research literature I've seen, including this review paper, is that recomposition is certainly possible. Okay, in fact, I advise it in cases of some people because they don't want to go through these major bloat cycles. If you're going to go through a full massing phase, maintenance phase to hold that new mass, and then cut, and then maintenance again, that could be 24 weeks, depending on how long each phase is. Where if you do a slow mass, in 24 weeks, you can see some significant gains in fat mass. You may gain a little bit of body fat if the goal is to mass, but not near like you would with the massing, the traditional massing cycle. You have to remember that we're talking about people that are using these cycles that are maybe more physique competitors. And so the rate of gain is desired, the rate of gain that's desired may warrant the uses of massing phases. And there's supplemental help as well. How does that play a factor in this? So for the average person who goes to the gym and just wants to gain mass and lose body fat, though, this is good news. And this video hopefully is giving you, encourage you that if you've been lifting for a long time, you can do this. Now, What you want to be careful of is not losing significant amount of body weight on the scale. At the worst, you want to see the scale maintained. So the ideal situation would be you weigh 200 pounds and you weigh 200 pounds 24 weeks later, but you've lost, 5 pounds of body fat and you've gained a pound of muscle mass, right? And that doesn't work out, but you get the idea. It's not a 5 for 5 switch off, but this idea that you're more dense, right? You have more fat-free mass than you did before, and the scale is hardly moved. I see this a lot when I work with people, especially bigger guys initially, when they first start to cut even. They have a hard time losing weight. I spit on myself. They have a hard time losing weight on the scale, but their body composition, their waist is coming in dramatically. And that's because you're seeing this increase in fat-free mass. It could be just body water and stores, muscle glycogen stores increasing again. There's all these other physiological factors. But the point is that they're not gaining body fat or not even maintaining body fat. They're losing body fat. It's just being masked by the increase in fat-free mass, which is more denser tissue. Okay. And so when we look at, is recompositioning possible? Yes. And the authors point out some very important factors, though, in doing so. One, you want to make sure your protein intake is adequate. And if the interest is to gain fat-free mass, that needs to be close to that 2.0, right, grams per kilogram, or even if we move into the other metric, 1 gram per pound of body weight, which is a little bit higher than that. So this is a good range to be in terms of protein. You may have to be more vigilant about meal timing. It's possible that's important. The more trained you get, the more anything you get, you have to be more mindful of the minors. Right? I've talked a lot about in my videos and the majoring in the minors. Many people major in the minors too quickly. So they worry about meal timing before they even get the adequate amount of protein. We'll get the adequate amount of protein first, then worry about meal timing. Get the big things done first. And so when you talk about recompositioning, it may be important to make sure you're getting adequate protein first, then look to meal timing being adequate. This article also talks about other factors like sleep, life stress. And the one I see commonly when I coach individuals is that when they try to recomposition, they tend to do things that are more cardiovascular in nature. So it's this idea, I'm going to attack the body fat side. Remember, the whole point is to recomposition is also to increase fat-free mass. So lifting weights and making sure you have a physique program of some sort. So you could be doing something that's more high-intensity interval training, but make sure there is a physique type of training also as part of your weekly training as well. Don't let it be all about high-intensity interval training. Or you may not see the gains in fat-free mass that you would hope to see. You might see gains in body fat or losses in body fat, but you also might lose some of your fat-free mass as well. So the programming has to be done in such a way to make sure there's a balance there too. So higher protein, okay? Make sure your protein is higher if you want to see recompositioning. Make sure your programming is such that you're pushing the volume of training and your physique side, and your conditioning, your cardiovascular type of training. It can be fairly flatlined. You don't have to have this wild progression in that, but just make sure there is a balance to it. You're not doing 5 days a week of high intensity interval training and 2 days a week of weight training. Well, that's not going to get it done. In fact, the opposite may be a better configuration if you really want to optimize recomposition. So that's good news. It's just like anything else, you have to manipulate the variables, including sleep and some of these other factors. You have to manipulate the variables in order to see the progress you want to make. And I think that goes for anything. It's a nice way to mass too, without, if you do it at a slower mass, it's a nice way to do it without incurring a lot of bloat. Most people don't want to be bloated for 8 to 16 weeks in traditional mass. They'd rather be a little softer, but you can see that your arms are really coming and you're starting to feel fuller in your musculature. That's okay, but it may not be as exciting to get gain 15 pounds, depending on how big you are. 15 pounds of body weight, and some of that is body fat, and it's clearly showing up in the way you look and the way you feel. And it may not be a healthy thing for you to do. So recomposition, yes, it's especially untrained. It's actually, I'm going to use the word easy. Just with a little bit of diet modification, it's easier to accomplish. You're starting out from nothing. Yes, you're going to see some body composition. For the person who's more trained, it's going to require more mindfulness, making sure you're hitting adequate protein intakes consistently, that you're managing your life stress and total stress well, and that your training program is the right configuration to making sure that you're providing the stimulus to use those calories, maintenance calories appropriately. And if it's a slow mass, again, you can up all the calories just a little bit. Again, be mindful of protein, and make sure your training program is certainly progressing in volume in order to make use of the extra calories. Even if it's just 100 calories per day, it doesn't seem like much. The scale will move very slowly, and that's okay. But you'll see an increase in fat-free mass a little bit to a greater degree, and the fat mass won't accumulate near as quickly. A mini cut will take that off pretty quick. So just some things to think about. And again, if you have any comments below, disagree with me, agree with me. Again, I'm working off of my experience, but also the I'll say limited amount of research, even though there's some pretty good studies. There's not a lot of them. Some of the limited amount of research out there that supports this idea that it is possible to see progress. The leaner you are, the harder it's going to be. The more mindful of these variables you have to be too, not just training age, but the leanness. And I'm assuming those things typically go together, not always, but typically go together. The more body fat you're carrying, the easier it's going to be to see recomposition, of course. And again, just starting out from where you are, checking that protein intake. Okay, I'll stop there so I don't talk in circles. I hope you found this information